Hello and welcome to my lecture on anti-arrhythmics. In this lecture, I will discuss drugs by class according to the Vaughan-Williams classification. So just to introduce you, I still prefer the Vaughan-Williams classification of drugs. This is a classification that groups them by how they work. For example, Class I is sodium channel blockers, Class II is beta blockers, Class III is potassium channel blockers, and Class IV is calcium channel blockers. In this lecture, we will discuss classes 1, 3, and 4. So Class 1 drugs, those are the sodium channel blockers. There are 8 relevant drugs in this class, and they are quinidine, procainamide, disopyramide, lidocaine, mexiletine, tocinide, flecainide, and propafenone. And that was really a mouthful. It's alphabet soup, and the trick is knowing which drug, which class. There are acronyms out there already, but for me, sometimes the acronyms are more difficult to remember, which kind of defeats the purpose of them. So I've come up with a couple of my own, and I hope they're useful to you. For 1C, we know 1C, drugs have very little effect on the effective refractory period and action potential. So we also know that 1C drugs should not be used on damaged myocardium. So the drugs in this class are finicky to none, or flecainide, that's finicky for flecainide, and propafenone, which has a terminal NONE. So finicky to none for 1C drugs. For 1B, we know that it shortens the ERP. So it puts a lid on the ERP because it can for tocinide, and mexiletine you can remember because it comes right after, it starts with M, which comes right after lidocaine. So the drugs in 1B are lidocaine, tocinide, and mexiletine. The side effects of these drugs. Now, I would encourage you to try and remember side effects of any type of drug in relation to their mechanism of action. If you take an example from psychiatry drugs, if somebody's taking a drug for insomnia, a side effect of the drug may very well be somnolence. Not all the time, but most of the time. So as you go from subclass A to C, just know that the side effects on the heart get worse. So when we're extrapolating the side effects from the mechanism of action, for 1A, since it increases the ERP, it increases the QT interval and can lead to torsade de pointes. For 1B, they're kind of the anesthetic class. They decrease the ERP, and that can cause a depressed cardiovascular system. 1C oftentimes leads to arrhythmias, and it can be particularly catastrophic to the AV node effective refractory period. There are only 2 major side effects that are really important to remember for the drugs in this class. For quinidine, and quinidine is basically a cinchona bark derivative, tinnitus plus headaches plus anticholinergic toxicity, and remember that acronym dumbbells for anticholinergic toxicity. Procainamide can lead to drug-induced SLE. So procainamide is a really big drug on the list of drugs that causes lupus. Class 3 drugs are the potassium channel blockers, and they are amiodarone, ibutylide, difetilide, and sotalol. There are no subclasses in Class 3. So Class 3 is a class of last resort. I would consider only ibutylide, difetilide, and sotalol together. And I'll explain this in a minute, but they all increase the action potential, effective refractory period. And so those 3 drugs, just to remember, they increase the action potential as well as the effective refractory period. But amiodarone, the special one, changes the lipid membrane. So if we're changing the lipid membrane and not just affecting one particular type of channel, everything passes through the lipid membrane. So since you're changing it, this drug is going to exhibit properties of all the antiarrhythmic classes, and it's going to prove to be really dangerous. So on to side effects of the Class III drugs. So if we're extrapolating from the mechanism of action, they're increasing the ERP, increasing the action potential, and thereby they prolong the QT interval. So remember, when you prolong the QT interval, what can you precipitate? So back to amiodarone the wonderful. Since it alters lipid membranes, it's going to be responsible for a whole lot of toxicity. It's like everything but the kitchen sink: pulmonary, hepato, and thyrotoxicity. It also leads to nerve dysfunction and corneal deposits. You should check function tests accordingly. So you got your PFTs, LFTs, TFTs, and of course, it's going to cause cardiovascular dysfunction as a side effect. Class IV is a calcium channel blockers. They decrease conduction speed and they increase the PR interval. The dihydropyridine calcium channel blockers are in this class, so verapamil and diltiazem. The side effects extrapolated from the mechanism of action would be the usual calcium channel blockade, constipation, AV nodal block, and there's also edema that's very common. So that's my presentation on antiarrhythmic drugs. Please continue to watch and learn from these videos, and also please subscribe to my channel.